short statements, and then we'll open the floor to questions and answers. If you picked up a sheet and you have a question already written that you'd like addressed, please send them to the front now.
Thank you, Emily, and thank you for inviting me to talk to this audience today. The things that you said, we take in consideration, and I want to tell you that one of my great loves is zoology and the environment, and I've never forgotten that. Truly, I'm a physician. I'm glad I am. I enjoy it. That the environment, the animals, the plants that we live around, that we exist with, that we should care for, are certainly a priority of mine also. This oil spill was classified by the EPA as a major disaster, a major spill in Mayflower. And it occurred, think of it this way, on Good Friday, in this quiet residential district, where people were preparing for Easter, their children for Easter. It was a happy time, a good time. And then this pipeline ruptured. And it ruptured, fortunately, on an afternoon when people were around, not in the middle of the night, and not remotely. Unfortunately for the residents, it ruptured in their area where they live. This pipeline, Emily, have you shown the history of the pipeline? I don't want to go over it. If I do show some things, just call my attention to it. It's an old pipeline, and that's part of the problem. Runs through a residential district. Yeah, that's part of the problem now. It originally was kind of backwards to what it is now. The flow was really from Texas up to Chicago, and then they reversed it. They changed it from Patoka, Illinois, to near Beaumont, Texas. It carries the Canadian heavy crude from the Athabasca oil sands. I think Athabasca is an Indian tribe. This stuff is really very thick, and so it's got detergents in it. It's got benzene in it, and there are various pumping stations along the line to get this stuff pumped through. And of course, the capacity is important. The more oil you pump, I've been called to task on OIL. I'm from southern Arkansas. I'm from oil country, OIL country, and I'm used to oil spills. I call it oil. And I'm probably going to say that. We had oil spills all around where I live, in Northwood, Arkansas, near El Dorado. So oil is not foreign to me. Now this type is. I smell oil spills, but nothing like this. So the route of this pipeline goes from Patoka, as I said, all the way down to the processing facilities around Nederland, Texas, Beaumont, Texas area. It's a very important thing, these pipelines. Lots of money. That is invested in this pipeline. So, on March the 29th, in the Northwood subdivision in Mayflower, Arkansas, the rupture occurred at 2:37 p.m. It was identified at 2:38 and shut down the pipeline at 2:52 p.m., but not before 2,010 gallons, 20, nearly 5,000 barrels of oil were spilled. And this is the rupture that you see here. 2 inches by 22 feet. And this is the oil. And it's coming down through one residential area. The resident heard a loud bang or a loud noise and looked out and saw this. And it's flowing fast, like a creek. And it flows past these two houses. It flows into the HVAC system, the air conditioning system. And it flows under the foundations of the house. And that's important. And I think you've seen before the route of the pipeline and the flow, the actual flow, as it goes under the interstate, under railroad tracks, and into the cove area. The important thing here was to quickly stop this oil from getting into Lake Conway. Now, the local responders, the county judge, the mayor, the fire department, the police department in Mayflower, Arkansas, took immediate action when this occurred. They immediately evacuated the homes, 22 homes, in the area of the spill. Some people could not get back in their homes. Others were simply told, get out right now. Don't gather anything up, get out. And they were quickly evacuated. Others had left in the area. Probably 5 families, additional families left. But the 22 families that could not get back in or were evacuated had to be rapidly placed. They could not get back in. One individual was evacuated so rapidly he left his little dog in the home. Now he walked back into that home to get the dog. And that's one thing that's important in disasters. Our pets. You've got to get the pets out. And that's one thing at the Department of Health that we are very focused on in disasters. Not only the families, but also the pets. Because they're going to get those pets out, or they're not going to leave. But this evacuation was rapid. And by 5 o'clock, easily before 5 o'clock, the residents were out of the impacted area. What happened then was a team from the Center for Toxicological and Environmental Testing and Health showed up immediately and set up air monitors. And they had devices where they could immediately read, immediately what the volatile organic chemicals were in the air, the benzene. And the benzene was elevated in the evacuated area. No question about that. As the monitoring was going on, and the people safely evacuated in the immediate zone, the following morning, at early morning hours, 3, 4 a.m., the EPA showed up. Exxon, of course, was there. The county judge was there. And they showed up in this little tiny office, mayor's office, for what is called incident command. And you can see this is about 8 o'clock on Saturday morning. People are getting together. We're looking at the maps of the evacuated area. And I'm asking the question, do we need to evacuate any more people? What do our air analyses tell us? So I'm asking these questions right now. Because it might be 22 families, it might be 100 families. But think of it this way. The 22 that were evacuated are now being placed in hotels, their children, hotels. They're being placed, some are finding refuge with families. Others are trying to find rental houses And they're trying to find also, and they're thinking about, where are my children? What are we going to do about school? What about work? What about my house? What's going on here? There was a great deal of uncertainty. So around 8 o'clock, we're looking at these areas, and I'm asking about the values, about the air monitoring. These are some of our team. These are some of our initial team, what we call applied epidemiology. These are our scientists here that I'm talking to. One of them is a public information officer, but others are scientists that will do the analysis of the air monitoring that was being done. They're going to look at the values, and they're going to help us decide, does anything more need to be done? Do we need to uproot now 65 families from this area? Do we need an evacuation of a 3 to 5 mile area? Do we need to shut down the shopping center? Do we need to stop businesses? Do we need to interfere with people's lives any more than we've already done? So we looked at all of these areas. We knew that the 22 families that were evacuated, it was done appropriately. And so we started looking at, this is an aerial photo of the spill and the trucks. And this is on Saturday, and I'll get into the air monitoring. This is on a Saturday. It was raining, it was cold, and the oil, probably the off-gassing, was inhibited by the environmental temperatures, by the weather. Had it been hot, I think there would have been a lot more off-gassing. Instead, this oil was being rushed away from the community, down storm drains, and unfortunately into the cove, where environmental damage was being done as on this day. So the weather conditions were cold, it was raining, and this stuff, while it had been shut off, was still going out and into the storm drain and headed for the cove. On the morning of the spill, I wanted to look at this oil, and unfortunately, I should have had a measuring stick. The oil was about this deep, at least this on the surface, and it was thick, and it was heavy, and it did smell. This is Lake Conway. You can see the boom to collect the surface oil, and this is an aerial view more of the oil as it comes into the cove, and you can see Lake Conway over there. The primary thing was, don't let it get in the lake. Don't let this oil flow into Lake Conway. These are some of the collection mechanisms for getting this oil out, vacuuming it out. So that afternoon, we had a meeting with the residents of Mayflower, and we talked with them about what was going on. And what we said was this: we're going to do air monitoring. We're going to do the sampling of the air. We're going to see how safe the area is in your community. Exxon said, we have someone you can call for claims, et cetera, et cetera. We answered any questions that the residents had. And we also said, we have a 24/7 call system set up at the University of Arkansas for Medical Sciences, at the Poison Control Center and Drug Information Center. This is manned 24/7 by physicians, by pharmacists, and toxicologists that would advise you if you think you have a problem, and will also give us an idea as to what's going on and what type of interventions the Department of Health might need to do. And this was told to the residents. And it's also put on our website. It was also sent out in any type of public information that we distributed by paper. Here we are at the time that we meet with that we're meeting with the residents of Mayflower. There's the county judge. The gentleman in blue is the EPA representative. I'm representing the Department of Health, and Exxon is there to answer questions. And so that day, one day after the spill, we set up to answer questions. Now, yes, my arms were folded. I want to tell you, this is not the posture you should have when you're answering questions in a public forum. But I want to tell you, we went there we absolutely went there with good intentions to answer whatever questions we could have for the public. And they did ask good questions. They wanted to know about the Poison Control Center, and we did tell them about those. After we went to the town hall meeting in the mayor's office, something called the Unified Command was set up. The Unified Command. So several hundred individuals that responded to the Mayflower incident, consisting of the EPA, Arkansas Department of Environmental Quality, etc., that managed the spill under one command. These are some of our scientists that analyzed the air results. And we did outreach activities with the public, press conferences. We did and distributed multiple fact sheets pertaining to the site and to the spill. We participated in meetings with the residents that were evacuated from their homes. These are the residents, actually, that were quickly rushed out. We participated in one-to-one meetings with them to answer any questions, any health questions they might have. And we released documents numerous times, and we participated in the production of a public service announcement video with the State Surgeon General and the Attorney General's office. The outreach activities are that we reviewed all air quality management. Here's what we did at the Department of Health. Our environmental epidemiologists looked at the readings of two separate organizations that did the air quality management. We looked at the data from these two organizations, CTEH and Weston, to see if their air quality readings were the same, were there any blips, were there any discrepancies, and we found none. We evaluated both real-time and air monitoring data and analytical air sampling. Our samples that we looked at are based on hard scientific evidence that is vetted by the CDC, the Agency for Toxic Substances and Disease Registry, and by the EPA. So our air sampling methods and the data that we used is based on the federal guidelines, both EPA and the CDC guidelines. We did ambient air monitoring from March the 29th to May the 28th, and ambient air sampling from March the 29th to April the 11th. We did handheld air monitoring on the in and around the affected area. And I don't know whether you can see this, but we did mobile arrays of volatile organic chemical concentrations on the 29th of March when the spill occurred. All of these are analytical air measurements that were done by these two organizations, CTEH and Weston. Analytical air stations were put, we did sampling in the various areas around the site and also distant to the site. And we did measurements and looked at measurements of air contaminants in the community and work areas following the Mayflower oil spill. The total air measurements, when you look at the total number of chemicals that were analyzed, both on the handheld and canisters, they're called SUMA canisters. What they do is they take in air over a period of 8 hours, 24 hours, and then this is sent off for measurement. There were over 1,740,000 total air measurements done. So we did quite a bit. Now, if you look at the analytical air sampling on the day of the spill, you'll notice that the benzene level is at around 100, a little over 100 parts per billion in that area. So it rapidly came down by the following day. The benzene level rapidly came down to air levels that were not a threat to the public's health. If you look at urban areas, you'll notice that certain urban areas will have benzene levels that are much higher elevation than what we found on our sampling in the Mayflower area. gas stations, if you look at, let's say, that might be 35 or so parts per billion or so. If you look at what is around gas stations, when you fill your car up, you're inhaling benzene. Well, at gas stations, our levels were actually below what you would see ordinarily with gas stations. Average levels of benzene in outdoor or ambient air. Urban levels, 40 to 160 parts per billion. Rural areas are better. So if you live rurally, you're not going to get a lot of benzene there. Indoor, 1.8. It depends on what you have indoors. If you've got in your carport gasoline or some other volatile organic compounds, you're going to have a higher benzene level. If you burn candles indoors or incense, your levels of volatile organic chemicals are going to be higher. So there are levels of benzene all around us all the time. Smoking, of course, in public health is one of the major contributors of benzene inhalation. And just want to let you know that if you're around smokers in areas that smoke, you're going to get some benzene. The cleanup process continued. It continued rapidly, and the area impacted in Mayflower was restored by these remarkable efforts of Exxon. Now, I'm not letting Exxon off the hook, but I can tell you that they put in remarkable efforts to clean this thing up, this spill, this disaster up as quickly as possible and as reasonable as possible. But let me tell you something else. In participating with the talks with EPA also held their feet to the fire. So in a lot of the conversations in our Unified Command, EPA, regional EPA, coming out of Texas, held Exxon's feet to the fire on anything that they thought might be lagging. And I was very proud of the EPA. And I can tell you the Environmental Protection Agency is a remarkable organization that we should all be proud of, and hopefully will continue on its mission, because it certainly helped this small community of Mayflower out. Cleanup efforts, these are really weeks old. The cleanup effort is still going on. This is where I put the stick in the oil. Now, is this clean? No. It's not clean. I think you can still see oil around there. So this has been significantly impacted in this drainage ditch. This is the water that goes into the under the freeway and into the cove. This is the cove area with booms. The cove has been negatively impacted. It'll never be the same, in my opinion. Never. Probably I talked with the Game and Fish Commission. Thousands of animals were killed on the soil. No question about it. So the point of it is this oil had a remarkable, in a significant and an adverse environmental impact on the cove. The one thing the cove did, in kind of a metaphorically sacrifice, it took the hit so that Lake Conway would not be polluted by this oil. This is some remedial activities in the area of the pipeline rupture. So now residents are talking to us and they're saying, when can we move back into our areas? When can we move back in our home? And we said, not until we know that there are no elevated benzene levels in your home. We went out. We went with some of the individuals that were doing the monitoring inside the homes and looked at the benzene levels in the homes. And until the levels were normal and below public health concern, we did not give any approval for individuals moving back into their homes. As far as the health outcome data, our Quest Control Center received 37 calls, 19 individual cases. Most of these occurred in the weeks following the spill, the short weeks that followed the spill. Most common reported symptoms were headaches, nausea, some vomiting, some reported dizziness. This is not unusual. This would be expected from something as odoriferous as this spill. So, we feel like that the public was well informed with the Poison Control Center. They were notified, the public was notified through Uniform Command public meetings, through various releases, news media. We encourage the residents to talk with their personal physicians. And the reason is family doctors, internists know patients well. Okay? They know their patients well. We said, do not come out of your medical system now. And if you've got problems, if your doctor wants to call us, he wishes to call me, they can call us. But we encourage them to see their personal physicians for any health problems they might attribute to the spill. That's the first thing. That's the first thing most people would do. Now, one thing that I think is important, and I have said on numerous occasions, I think the physical effects from this spill will be minimal to zero. And that's because of the rapid and effective evacuation of residents in the vicinity of the spill. But what I did and do think is that there will be trauma, emotional trauma, and post-traumatic stress from many of the residents in the area and perhaps even distant from the spill. And that's not unusual in any disaster. If you were evacuated, if you couldn't get back into your home, or if you thought you might be evacuated, I think you would have some significant concerns from the uncertainty. Also the value of your home. What about the value? What's going to happen to that? The last thing I'd like to say is what this uncovered. Now, this was extremely unfortunate, what happened here. And let me tell you the future public health implication, and one of the most, if I say that I'm concerned about what happened here at Mayflower, no question about it. But what did it uncover? It uncovered the vulnerability of the Lake Maumelle watershed. Of the water, the cleanest water in the United States is in our Arkansas state, and particularly at Lake Maumelle. And so what we've got here is a pipeline that runs by the Lake Maumelle watershed. It serves 400,000 Arkansans, maybe more, in central Arkansas. It's a big watershed. And it runs right along it for several miles. And here's a photo of the right-of-way. The pipeline goes under a creek. This is what they call airborne. It's over a creek. Here it is in a creek that has lots of boulders on it. Can you imagine when this creek floods and those boulders hit this pipeline, what damage it might cause, either external or internal? This is a pipeline showing some erosion of the pipeline on top. Again, an airborne type of pipeline. Pipeline covering is coming off. And so I think that what we have here is a threat to our water supply. And that's what this is uncovered. And you'll see in the paper today continued concerns about central Arkansas water, about this pipeline. But this pipeline runs across 18 watersheds, or drinking water sources in Arkansas. So the important thing here is what it also uncovered, and what we cannot ignore, is the potential threat to our water, your water, of this pipeline should it rupture again someplace that we don't, whether we respond to rapidly or not. It could pollute an entire lake. If it polluted Lake Maumelle, if we had the same amount of rupture in Lake Maumelle, let's just think, what would happen? Water system, our water intake system would be shut down. The water purification system shut down. Hospitals, water to hospitals shut down. dialysis centers that rely on water shut down. The faucet that you turn on, it wouldn't turn on. The most important implication a water engineer told me, he said all of that could be remediated. It might take years, but here's what would happen. The trust of Arkansans, of their water source, their pure water source, would be eroded. The trust in turning on the faucet would be eroded. He said that was the most important thing that would occur from the spill. You would never turn your water on and say, I trust the system. It's pure water. So I just want you to think about that in the context of what happened in Mayflower. So I want to thank you very much, and I'll be happy to answer questions. Yes?
Knowing what you know now, would you have evacuated a larger area?
Okay, the question was, knowing what I know now, would I have evacuated a larger area? The answer to that is no.
Well, you've been wrong,
Okay?
because my whole family has been sick. We are 300 yards from that rupture site. And just because there's a fence between us and the oil did not keep us from being contaminated. My 3-month-old grandson has lung problems. I was so sick, my doctor finally ordered me to leave my house because I can't stay there. I get so sick. So I think, one, you need to reevaluate how large an area you evacuate. Two, you need to reevaluate your air monitoring levels, because you can't come in and say, oh, it's below level of concern. Well, no, it's not below level of concern. I went and had my whole house sick. And the poison control number, was that given to the Arkansas Health Department? Because that's who I called numerous times, trying to find someone that would take my information, and they didn't know who to give me to. They passed me from one place to another. So there's 3 questions, but that's my 3 questions.
Okay. You know, when you evacuate a population, you evacuate based on the data you have, and it's an emergency evacuation. The county, judge, the mayor, the local fire and police department did a remarkable job. A remarkable job. I think they should be congratulated on that. They got residents out. Now, to evacuate a larger area, we looked at our air monitoring, and we said, you know, the levels are now down. They're
You said
down.
it was raining that day.
It was.
Read it?
Yes. The levels were,
weeks straight.
yeah, it did rain a lot. We evacuated the areas that we thought were appropriate because our air monitoring showed there was no risk to the public.
Well, they're wrong.
Yes.
In relation to that same question, could you explain why this elementary school, as close as her, with kids going outside during recess holding their noses, wasn't evacuated at all? I feel like this woman is making a very valid point, and I think our state failed us in the evacuation of the areas they did not evacuate. Why? My question related to her question is, why was not that elementary school evacuated?
The elementary school, we did the air monitoring at the elementary school and found that the levels of benzene were below those that we would initiate an evacuation. There
But
we
yet the school teachers there that were going out for recess had to tell the school administration they would not go out during recess because they were having headaches when they went out during recess. Something is wrong.
Children are going home sick almost every day.
They're still sick.
Yeah.
Again, the levels.
Did the
need
gov-
to be reevaluated.
Sorry, you were next. Yes.
So I asked this question because I have looked at maps of the spill site, and I was there a few days afterwards, and there were homes that were actually closer to the rupture point than some of the homes that were evacuated, and those homes that were closer were not evacuated. And my question is, based on the fact that we saw Exxon largely in control of the situation after the spill, as in rather than the regulatory agencies, was Exxon involved in the decision to only evacuate those homes?
No.
So it was your decision? I have a follow-up question also. Why did the health department not take any measures to provide the workers, many of whom were hired off of Craigslist from the local population, with any respiratory protection? I was there
Well, the workers were probably employed by an organization that should adhere to OSHA guidelines. That's number one. Number two, we did not monitor the workers. We did not monitor the workers. That was not something that we did. Our concern at that time was to make sure that the population was, of the citizens in this area, the residents were assured that their air was safe to breathe and that they did not need to be evacuated. As far as the workers that were there without, as you say, without appropriate respiratory protection,
Without any respiratory.
no respiratory protection, would have required their employer to, and OSHA, to intervene at that time.
What about people that work at Subway?
Pardon?
What about people that work at Subway that's right there by the creek? And the drainage.
The drainage ditch. The air monitoring areas that we looked at there, the VOCs were elevated on the 30th. There was also lots of traffic in and out of that area for the workers that were coming to Subway. And these were car exhaust, these were exhaust fumes also. So there was a lot of activity, a lot of business activity coming to and from that shopping center. If the Subway's in the shopping center is what you're talking about. Yeah, there was a lot of activity. I saw that. The problem there was much of the activity, much of the VOCs were coming from the car exhaust. Yes?
Did the governor's office ever inform you of a more appropriate technology that could have been employed than the paper towels that Exxon was using? Did they ever say, hey, use this instead? And if they had, how would you have responded?
A technology for cleanup?
Yes, or to keep the oil from migrating.
Well, the agency that is in charge of the cleanup, that we are a support agency to, is the Arkansas Department of Environmental Quality. And you would have to ask them that question.
Well, if they're only a complaint-driven organization that doesn't deal with human health, how can they make that move? It seems to me that would land on you.
Well, you would have to ask ADEQ about that.
Well, they tell me to ask you every time I do. And that's a real problem.
Well, ask me again.
Well, no, I've been running this circle for 4 years now. I think it needs, do you think if we use the ADQ, if we change it to the Arkansas Department of Environmental Protection instead of quality, and they're actually an enforcement agency, would it be a better thing for the people of the state?
I think you would have to ask someone else besides me on that question. That's a question that would require, I think, someone in a different agency or a higher authority than I have. Yes?
I have a two-part question. For the bill, Department of Health is aware that the exit line is pumping poison.
That's a good question. I'm not aware, I'll tell you, I'm not aware that we knew they were pumping, the Department of Health knew they were pumping poison. We knew that, when I say we, I'm talking about various agencies, we knew we had a pipeline in various areas. As far as the Department of Health, we had no knowledge about what was being pumped through this pipeline. To my knowledge, our engineers might have a different take on that, our water engineers. I don't know that we knew that.
What step has the Department of Health done to educate the employees and affiliates about the properties of the poison?
Like, there has been, for instance, Tuesday night, there was a meeting with the city council that I attended simply as a guest. I didn't participate, where the county judge, Alan Dodson, and people were asking about their residents. Is that what you're talking about the impact on the residents?
I mean, the impact is since we have a pipeline, 15 gallons of it, I was wondering what steps the Department of Health has done to educate its employees about the
We're still in the recovery phase right now, this neighborhood. And when you talk about educating, what are we doing in the Department of Health to educate our health department on the negative effects of tar sands oil? Well, we have given several presentations. We've given presentations to our health department, or something called public health grand rounds, and we'll continue to do presentations about what the tar sands oil contains. For instance, as I mentioned, the detergent, the benzene, and other things to make it more liquid. And I'm getting a little bit out of my field here, but things to make it more liquefied and easier to push through the line. We are very interested in that. And I'll tell you the people that are very interested in that are our Central Arkansas Water. They're very interested in this one. They're interested in, is this pipeline going to reopen? How much oil is left in this pipeline? And our Director of Health has sent a letter to the Pipeline Hazardous Material Authority asking that this pipeline not be removed or relocated from our watersheds in Arkansas, particularly Lake Maumelle. Now, he did receive a letter back from the Pipeline Hazardous Material Authority. You want to ask me what it said? You want to know what it said? Absolutely nothing. Okay, so when our director, acting in good faith, says, look, I want this pipeline moved or relocated, and he asks the Pipeline Hazardous Material Authority, the letter he receives back is the most undefined response, one of the more undefined responses I've seen. So at the Department of Health, we're asking, so what are we learning from this? What we're going to learn from, and we're going to learn from, but what are we learning from this whole thing? If we don't take a precautionary principle, this is the basic principle in public health. When an activity raises threats to harm to human health or environment, precautionary measures should be taken even if some cause and effect relationships aren't established. A shift from reaction to prevention is consistent with core values of public health practice. Now, you've asked some very good questions today. You've asked very good questions. During an emergency, we do the absolute best we can to prevent human harm. But the one thing that we've learned from this is that we don't question where this pipeline is located and say to the pipeline authority, to say ExxonMobil, don't restart this. You want it restarted in the Mayflower area? Okay, we're asking that question. That's the question we're asking. Don't restart this. So our health department, we're looking forward as far as we can. Don't restart this thing. We don't want it near the water sources. We don't want it near Mayflower. Okay? We don't want this thing restarted. So we are doing the best we can, and we can do more. Central Arkansas Water is saying, don't restart this thing. What about the 18 water sources in Arkansas that this thing runs down?
Actually doing a council meeting about that coming up on October 2nd.
Okay.
So a lot of people are getting
Right.
information and figuring out.
Right. And let me tell you this, from an environmental viewpoint, you know, I'm talking from the Department of Health, and I don't want to stray to the ADEQ, Arkansas Department of Environmental Quality. But if this pipeline had ruptured, think of it, anywhere else, I'm not talking about Central Arkansas Water, but somewhere out in the swamp or someplace, the environmental impact would have been far worse, far worse. So what I want to tell you is, questions have been raised. We want to help this community heal. We do want to help it heal. It's been impacted adversely, but we also want to take precautionary measures to prevent it from ever happening again. Yes, ma'am. That's the initial thing.
That's the initial thing. Well, I guess it raises the question of how are you to know that these physicians are trained in something that is to this disaster? Also, why should people that don't even know there's a pipeline built under them be responsible to pay to go to a physician? Remember, they're not the people that caused this disaster. And, yeah, that's basically what I was saying. Why do you guys think that? And also, maybe they don't have health insurance. Why should they be responsible for paying for all of that stuff when it's not their fault for that to happen?
Right. Yeah, you know, the thing about physicians is this. Generally speaking, I trust our physicians in Arkansas. I trust the physicians around the Mayflower area. I know them. I know they will take their patient's best interest. I don't want to interfere with patient-physician relationship and say, hey, you need to see such and such. I don't care who you go to. You need to see this particular doctor, whomever. But what we have said is that if patients feel they have been harmed by this spill, whether they have insurance or not, they can come in for a health assessment, and we can do the assessment, an initial assessment, and get them, if they so desire, and if we think it is necessary, to physicians at the University of Arkansas for Medical Sciences.
When did you start offering this?
About 3 weeks ago, 2 to 3 weeks ago.
2 to 3 weeks ago, and this has been 6 months since it's happened.
That's correct.
So, isn't there something wrong with that? Do you think that some health checks should have been maybe, they should be available to be checked on, a week after it happened, a day after it happened? Something that could have been taken care of a little bit before, isn't that something that's important?
Well, that's why we utilize the Poison Control Center, and that's why we utilize the Poison Control Center. We worked with the Poison Control Center. We said, and I talked with them. I went over. I know their director, Dr. Hal Foster. If there are individuals that call the Poison Control Center, like Saturday or Sunday, and they have significant concerns that you feel we need to be notified on, we want you to call us. We want that initial hotline to be established. It's answered 24/7, not just 5 days a week. And that was one of the things that we did.
Expanding your first question a little bit, do you think your Department of Health has adequately addressed this disaster since it's happened? I mean, you're stating to her that it's been 6 months after that there was actually doctors that are responding to people who need help. Do you feel in general that the Department of Health has responded to this adequately and appropriately?
The answer to that is yes. And let me tell you why. With the ambient,
In spite of the fact that it's taken 6 months for you to get doctors that are able to do it, I think a lot of us in this community strongly disagree with you, Doctor.
and I understand that. But based on the air monitoring that we did, which is the primary thing, the primary source of intake of chemicals, primary source was inhalation. And that is what we looked at, and that's what we looked at with our air monitoring. If there are no elevated levels of benzene, of volatile organic chemicals in the area, an analysis of health effects would not be indicated. Yes.
Doctor, has the Department of Health ever seen the chemical analysis of the tar sand oil?
It's a good question. I believe our environmental epidemiologists have an analysis of that. They have to, in order to look at the readings for the VOCs. I'm going to have to say, for that question, I would have to check with our applied epidemiologist. I'm going to say tentatively they do know what it contains. But I'll tell you, I will be happy to find out and get back with you. So just let me know after this, and I'll let you know.
You know, I do know, Doctor, that the companies that manufacture the solvents and mix them, they are proprietary and they do not need to release them. So I think you're going to find that you do not know exactly what's in it and what the solvents are. There are several carcinogenic.
So we need, okay, so that's a good point. Listen, I want to tell you, I'm here to learn also, and I'm learning from you. We will find out, and if it's proprietary, like fracking fluid is, right? Okay, you're drilling a mile underground?
But not to you. But not to you.
What?
You have the power to find out the proprietary information.
We do have,
Yes.
from a public health viewpoint. So, to follow up on what Emily said, fracking fluids, they won't let us know, they don't let us know. You know, you probably, the Department of Health has had an interest in Conway for many, many years. 1998, 99, you had a developer that bulldozed an egret rookery and killed 5,000 egrets in your city. The Department of Health had, what was our interest in that? The question came up, this is a nuisance at rookery, histoplasmosis is coming from this rookery health department. Tell us if these people have contracted histoplasmosis from this egret rookery. We looked at our statistics. We objectively said, there's no evidence of that. There's no evidence of that. So the developer, the politicians can't say, well, we did the right thing. We looked at it scientifically, went through our records, no evidence of histoplasmosis being contracted from the river. What's the outcome of that? U.S. Fish and Wildlife Service fined the developers, two developers, $48,000, please. That's probably the cost of doing business. The second thing that occurred in Conway, so we have an interest in Conway, yes. Detco explosion. Do you remember that? A huge chemical fire. Who were the residents there? There was a trailer park adjacent to this chemical fire. Poor people around a chemical factory. Department of Health went up, looked at it, and so on and so forth. You know, the analysis there, what did we learn from that? ATSD, or Agency for Toxic Substances and Disease Registry, we didn't have enough air monitoring done at the Detco explosion, in and around the Detco explosion, to make an adequate assessment of the potential effects around the population. And that's on ATSDR. Because we have to write up every type of disaster that we're involved in. We had inadequate data to make any analysis of that. What about the second incident that occurred in and around Conway? An oil well, gas well was being drilled. And y'all know what I'm going to say. And this well, when you're drilling a well, lateral drilling now, one site can put out 3 lateral drills and tap into gas reserves. They use cesium-137 for seismic to look at their logging. Cesium-137. When it was time to pull the cesium pellet out from underneath Lake Brewer, your water source. So we have an interest in this, you see. They couldn't get it out. Now, it's 1 mile underground. It's a pellet the size of a pencil eraser. And our assessment there is that's not going to harm the water quality. But did you know the Department of Health licensed radioactive materials? Did you know that we made an assessment of that? Do you know that we put a sign up that says, caution, radioactive material here? And then the fourth incident was the Mayflower. And we learned from that because we put up air monitors immediately. We had things stationed immediately. We read those readings immediately. We learned from the Detco explosion. And that's why I can say that based on our evidence in our air quality monitoring that we reviewed for weeks and months, do not feel that we should have had a wider evacuation and uprooted hundreds of residents from their homes.
Do an intercept at my house.
Nobody was at my house.
Okay.
That's right.
I think part of the problem here is that there was no reality check. There was no visiting with the community to get their feedback. There was no checking to see whether or not the poison control hotline was actually
Yes, I'm sorry, you've had your hand up a long time. Yes, yes, ma'am.
Well, one of my first issues is you were talking about the shopping center and all the exhaust and everything that was let off from vehicles and the traffic in and out. Well, I've lived in Mayflower 28 years and I've always shopped in that shopping center and never once in one of its busiest days during Christmas or Easter or Halloween or any of those instances have I ever walked in that parking lot and got nauseous, headaches, vomiting, and dizziness just from walking through that parking lot to go to a store. So I do believe that your account for the exhaust and everything is actually quite null for the incidents that the chemicals that were in the tar sands that spilled through our town are extremely that much more concentrated and toxic. Number two, you measure in parts per million, but if you do just a little bit of research, like I have since I live in Mayflower, these chemicals are toxic at the parts per billion range, not parts per million range. So that does not adequately actually assess the environment or the people in the community in the parts per million range. Number three is, how long will the health assistance continue?
Okay. So you made a statement, and you know, what you're asking is a technical question, and it's needs to be amplified. And what I don't want to get into are the highly technical questions that you're asking, parts per million, parts per billion. But I will tell you that I'd be happy to talk with you, or I can get you to Lori Simmons, who is our expert, and then you can go over, you all can discuss this, but I'd like to not get into that right now. You're talking about parts per billion, parts per million, and what the toxicity is.
Do you have her contact information?
Yes, I do, and I'll give it to you, sure. Hold on, sheet there.
I guess my point is, if you go to the grocery store and buy a package of potato chips or a candy bar, there's a list of everything that you're putting into your body. You have a right to know that. People that live next to tar sands or build that pipelines, on the sign by ExxonMobil or whoever the company is, it says petroleum product. I'm wondering why the Department of Health is not pushing for truth in advertising, because we know that these pipelines do leak and spill. People that live next to them have a right to know what they're being exposed to.
Yeah.
You're talking about.
Yeah, and so here's what, and I can tell you that the people that have the authority there are the Federal Pipeline and Hazardous Material Authority. That is a question, that's number one. Number two, Arkansas Department of Environmental Quality, number three. And I will find out a little bit more about the tar sands composition of this. And I've got time for one.
Those are industry people that control those agencies, and if you can't stand up to them, nobody else will, then you need to lose your job.
Well, thank you for that comment. And let's see. Oh, yes.
I just want to tell you, Dr. Mason, that I have been very impressed with you. I've met you several times. You did my health assessment at the health department. And, you know, what I want to say here is I think you're a very fair man. You are giving us information that you have acquired, but we have other information that we have acquired that you're not aware of. Now I can understand that. My main question to you is, knowing what you know now, the disaster that we have had in Mayflower, is the state of Arkansas going to implement this? I guess what I'm saying, we need a doctor in this state that knows about our health conditions. Because you told me in the health assessment, I think it would be very, very expensive for me to travel, what was it, Denver you said, or wherever? We don't have anybody in the state of Arkansas that can test us for any kind of poisons in our system.
Or deals with exposure.
Yes, our
Well,
health exposure.
Well, let me.
Will the health department in the future, knowing what we
Yes.
know now?
Yes, let me tell you, that is one thing that I have discussed with some of my colleagues.
Right.
With this incident, what do we have? Do we have a center of excellence at UAMS?
No.
Do we have the Center of Excellence of Occupational Lung Diseases? Remember, most of this, and I appreciate what Emily's saying, you can track stuff in, things can be, you have your yard sprayed with pesticides, kids track these in the house. But the point of it is, we do need a center of excellence, okay? And the best place, I think, would be UAMS.
Well,
Now,
they won't even help you. I went
Well-
there 3 weeks after the exposures to see if I could hold my hand up, and they wouldn't even talk to me or even listen. They said, me home.
yeah, your point is well taken. I've had the same thoughts, and I want to share them with you. I want to be very transparent and say, we do need something like that
I mean, I'm
in this
not
state.
angry at you, I'm
Yeah.
just angry.
Yeah, I understand.
You know, and we need.
If you're gonna have a pipeline run through our state and there's these chemicals that bust out of it, there should be some kind of doctor or some kind of organization.
Well, what you need
that deals with that.
we need a center, and I really think a good center that says we can do all of the tests that are necessary.
That's what I'm asking.
And that's something we want to learn. Now, remember, we can't just go to UAMS or to someplace and say, we want you to start this. But we could start the conversations. Because if you look at the spills we have in the state at any one point in time, remember I may have told you about the poultry incident in Springdale, Tyson's factory, where we had 600 workers exposed to chlorine gas, 170 went to 5 hospitals, 4 were in intensive care units. This was chlorine gas. And the outcome of this was significant. We are going to continue to have exposures like this. So I want to engage the university in these talks. Okay? So,
If we're gonna keep having this happen, we need a center or doctors that can
well,
deal with our
you need a vetted, good center that says we can do this. I've got to go, and I wish I could answer questions. Maybe afterwards, get me outside. Thank you so much, Emily, for inviting me. I appreciate all of your questions. Thank you.